This conference will now be recorded.
Okay, hello, all of you, welcome. Happy New Year. May all of you fly with, uh, come out with flying colors. So, as the new station had come in the part 3 exam, so today I'll be just going through the WHO care guide made easy first. Like, first, I will be explaining this WHO labor care guide. After that, we'll be doing station, okay? So I just tried my best so I can help you guys, okay? And if I'm not clear anywhere, you can ask me question. So this is WHO LCG, or the labor care guide, okay? Now, what is the aim of it? And it is important you to know, because when you do station, you have to tell your student that why LCG is important. So I'll be just giving you few points, but to the your role player, at least 2 3 points about the importance of labor care guide you have to say, okay? So what is the importance or aims of LCG? Like, monitoring and documentation of uh, well-being of mother and baby and progress of labor, okay? Apart from this, to offer supportive care to ensure positive birth experience for women. Third, to identify and address any emerging complications. And then they're providing reference threshold observation, so that will trigger reflection, and specific action can be taken if abnormal observation is there. Another very important part that has been added here, to prevent unnecessary interventions in labor. Apart from this, quality purpose, to support audit and quality improvement of labor care management. So these are 5 points. At least to your junior colleague, you have to explain minimum 2 points. What is the importance of labor care guide? Okay. And labor care guide, it can be used in all healthcare settings, including primary, secondary, and tertiary care. So it is for all laboring women, okay? Apart from this, it is used for all women regardless of risk. So it is designed to for the care of women and their babies in the childbirth, all observation, all pregnant women regardless of their risk status. So it is not that you would be using this for the high risk women, or you will not be using for low risk women. No, so it is used in all settings, whatever is the setting, and it is used for all women regardless whatever the risk they are having. Okay, so it, apart from this, now, previously, that partogram was there. Partogram used to start from the 4 centimeter. So now documentation in this new labor guide would be initiated when the woman enters active first stage of labor, that is 5 centimeter or more cervical dilatation. This is regardless of parity and membrane status, okay? Apart from this, what is the reason why there had been a change and shift from 4 centimeter to 5 centimeter? So because this would reduce premature designation of active phase of labor, that has been major cause for iatrogenic, cause of poor apparent labor progress and unnecessary interventions. And the time of onset often is unclear, so duration is variable between women. So if basically if it is previously they are used to put at 4 centimeter, and so this phase is variable, and also like observation of the people will be different, and because of that, a poor designation of prolonged labor used to be done, and unnecessary interventions. The main cause for starting documentation at 5 centimeter is to prevent premature designation of active stage of phase of labor, and also to avoid um, unnecessary intervention in the labor. So this is the main reason for it. This role player, asked in the exam. Now, to simplify it, structure of LCG. LCG has got 7 sections. I'll be speaking. So, identify. This is identification details, supporting care, care of baby, care of mother, labor progress, medication, shared decision making. So though I'll be summarizing it at the end also. So what has been added here? New supportive care and shared decision making. This was not there in partogram. Now what they do, so they plan for systemic and consistent application, because whatever the way I am using, you have to use in same way. And so it has to have a universal same thing. Okay, all people should fill this in similar manner. So there has to be standardized approach. So what, when the for every parameter, first of all, the person who is observing the woman, they have to assess it. Okay, what is the parameter they are assessing? After that they would record it in the labor care guide. Then for every column there is a reference threshold, I'll be speaking about it. So they have to check. From checking, then analysis has to be done, whether norm like n- okay, everything, if any deviation from the normal, so accordingly plan will change. So to for systematic and consistent application, the approach is assess, record, check reference, and plan approach. So these are the four. How to fill it? So you have to speak this four word. Okay, I'll speak more about that also. Now, if we come to section number one. So section number one, this is the patient identification details. Apart from this, this is the time axis is there, and this they have put the alert column. And now in new LCG, second stage is also added. So this way the section 1 appears. Now what we'll do to fill it, so for every section there are certain abbreviations. Apart from this, there are certain guidelines to use every section of it. So for section number 1, ruptured membrane, time and date. If it is unknown, like patient doesn't know when the membranes have been ruptured, so the abbreviation used will be U, unknown. So apart from this, guidance for completing. Okay, so first was the name. So name of the patient has to be filled, whatever we know already. Then next will be the parity. Parity, we already know how to fill parity. Then labor onset, whether it was spontaneous or whether it was induced. So if it is spontaneous, you will write spontaneous. If it is induced, you have to write induced. Then like active labor diagnosis, date. So date will be in this whatever the format. Okay, then about the membrane, ruptured or not, so date and time. And if the status is not known when they were ruptured, or then or patient doesn't remember the time and date of it, then you have to then patient cannot report the date and time. So in that situation, unknown has to be written for the membrane. And risk factor, when we take this patient history, we take obstetric risk factor, medical or social risk factor. So like for example, this would be PET, preeclampsia, hypertension, advanced age, adolescent pregnancy, preterm labor, and GBS, whatever is the risk factor. So this is the guidance to fill the section 1 of LCG. Now this way, so this was the section we were looking at, and this is the example of section number 1. So you can see name of patient, parity, labor onset. Now it is spontaneous. Okay, then active labor diagnosis, so this is the date of it. Then ruptured membrane, patient remembers the name and time, so it is written. But if they don't know, then we have to write U. Okay, and risk factors are also given. So this is the example for this part. This is the easy one. Then you come to another. So this is the second section here. Okay, this is the second section here. Now this is the time. This is a time axis. So time axis will register the actual time for each observation, like 6:30. So here we have seen patient at 6:30, then 7:30, 8:30, 9:30, whatever. Now represents the 1 hour. Okay, so this is represents the time, and this will represents the 1 hour. Okay, each column is for 1 hour. This is for active first stage, and this is for second stage. Apart from this, here is the alert column. If any abnormal observation is there, So then healthcare professional, the any person who is monitoring the laboring woman, the healthcare provider, they, those who are monitoring, they would fill. If the doctor is monitoring, they will fill. If the midwife is doing, she will fill. If the nurse is doing, she will fill. So those who are doing the monitoring, they have got appropriate knowledge to use labor care guide will fill it. Okay. So any deviation, any alert column will present the threshold for abnormal observation. If any observation is abnormal, then they will they will circle it. And how the circling will be done, that I'll speak up in upcoming papers. Okay. So now this, I have already explained how to fill the this part. Now how to fill this part, so this with this part is filled. Okay. So this is a time, and these are the hours. These are the time and these are the hours. And according to this LCG, like first stage of labor starting from 5 has to be completed within 12 hours. Okay, it should not complete within more than 12 hours. This is for primary. For multi, I think I would tell this hours later, but I think it was 6 or 8. So because of that they have put 12 hours. Okay. So these are the 12 hours according to them. First stage of labor in the primary should be completed within 12 hours. Because of that they are not putting it more than 12. Okay. So this way the column 1 will be, section 1 will be filled. Okay. So now coming to section second, please all of you mute yourself. All of you mute yourself. All of you mute yourself. All of you mute yourself, please. Please mute yourself because the voice is coming. I don't know what is happening. Okay, fine. So coming to the second part, second section of labor care guide, this has been added new. This was not there in the partogram. So supportive care include companion, pain relief, oral fluid, and the postures. Okay. So this is the section 2 for the labor care guide. Now what are the abbreviations for it? Abbreviations for it, like companionship, if there is a if she's companion is there, then yes. If it is not there, then no. If woman declines, then it is D. So Y and D. Even in the for the pain relief, Y and D. So if the woman declines to receive pharmacological and non-pharmacological pain relief, so oral fluid again Y and D. And for the posture, it is supine. SP is for supine, MO for mobile. So these are the abbreviations for second is completing second section 2 of LCG. Now this is the guidance. Okay, so what is the guidance now? Like what I already said, that first of all what they will do, first of all they will assess. Okay. So first because there are four step for every parameter. So for companion they will do assessment. Then either it for recording in the LCG, either it will be yes, no, and D for declines. Now what will be the alert threshold? If it is no, if the patient says no, then it will be alert. Why? Because why she doesn't want any companion. So if she, someone's mic is on, please all of you, I'm requesting to close your mics. Okay. So this is I was speaking about companionship. So yes, no, and decline. So if patient is saying no, then that will be the alert. Okay. Now, so if the patient is saying n, so for alert you have to put that in a red line. And if the patient is saying no, then again we have to go there and ask women about the companion choice. But if she is saying yes or declines, then her preference will be continued, but she doesn't want that her choice. Okay. So no is the alert here. Now pain relief. So pain relief, if the patient says no, then it will be the alert. So in that situation, what can be done? We can offer epidural, we can offer like fentanyl diamorphine pethidine, or non pharmacological will be relaxation, breathing, mindfulness, whatever. Oral fluid, again, yes, no, and a D. And if the patient is saying alert, no, that is a alert sign. In that situation, we if the alert is there, so what will alert N is there, so we have to encourage women to drink according to her wishes. Now for the posture, we have got two like abbreviations: supine SP and mobile MO. If the patient is mobile, so we are happy, but if the patient is supine, that would be alert sign. So in that particular situation, we have to, like, if the SP is recorded, then we have to talk to women to move around freely, or like left lateral, squatting, kneeling, standing. So this way it is filled. Okay, now this is the example for the filled part of the filled part of section 2. Now companion N was alert, so they have put it red. This is alert. Okay, the pain relief was was N, so they have put that N. Apart from this, oral fluid Y is fine, so it is fine. They have not put anything. For posture, she prefers supine, so that is a alert sign. Again, it has circled in red. Okay, circled. So this way alerts are identified from the labor care guide, and they are circled like this. So this is example for section 2. Moving towards section 3. Section 3 is for the baby. So what it records: fetal heart, amniotic fluid, fetal position, caput, and molding. So what is the these are the abbreviations that would be used when we fill LCG. So fetal heart, if it is normal, deceleration, early late variable. So these are the abbreviations you will find in the labor care guide. It is very important to understand this, because this time they had given you a blank labor care guide so that you can teach a junior. Next time they can give you a filled labor care guide, and they will ask you to do interpretation. So unless you know every column, every abbreviations and every column, it will be very difficult to then explain. So understanding is important. Okay, so this is abbreviations for fetal heart deceleration. Second is the amniotic fluid. Intact membrane, I, we know it. Membrane ruptured but fluid is clear, C, we know it. Meconium is meconium, then they will record +1, +2, and +3. Non-significant, medium, and thick meconium. So 3 is the thick meconium. B is blood stained fluid. So these abbreviations. Fetal positions are APT. A is occipito anterior, P is posterior, and T is occipito transverse. Caput is 0, +1, +2, +3. That is according to the grading. Molding, again, +1, 0, plus 1 plus 2 plus and 3 plus. Okay, and these are the like these we already know. Plus is suture opposed, plus 2 plus is suture overlap but reducible. 3 is like sutures are overlap but we can't reduce it. So these are the abbreviations for completing section 3 of LCG. Now this you have to, like, too much, but I'll just explain you. So this is the guidance for completing section 3 of LCG. So fetal heart rate. So fetal heart rate, what they want, we have to listen it to at least 1 minute, that we already know. Apart from this, they want 30. If auscultation is done in the uterine contraction, then it should at least it should continue 30 seconds after the contraction also. Now first they will listen, then they will record. Recording has to be single heart rate, like 144. So this has to be like 144 or whatever. Okay, so one number has to be there. Apart from this, like now they have, there are certain, these are the threshold. Okay, threshold is less than 110 and more than 160. So this is the threshold. So you have to be very carefully listen and you have to put the threshold. Okay. Apart from this, now what they say, if patient if this parameter is coming in alert 9, so you will circle it red. Then what will be the plan will be put the patient on a left lateral position, and then senior review would be required. Okay. And but if the fetal heart rate is in the range, then every 30 minute in first stage of labor, monitoring has to be done, and every 5 minute in second stage of labor, monitoring has to be done. So these are the guidance for fetal heart rate. Now second part is fetal deceleration. So fetal deceleration, again, they have this is the these are the abbreviations that we just saw. No early late variable. So alert is what? L, late. If late decelerations are present, then there would be alert, and it will be put red, circled red. So if the late deceleration or single prolonged deceleration is present, what will be the plan? Put the patient on left lateral position, review by the senior healthcare professional. If it is not there, then first stage of labor, fetal heart monitoring 30 minutes, second stage 5 minutes. Coming to another part is the amniotic fluid. So amniotic fluid, if it is intact, I, clear, C, ruptured and meconium, M, plus 1, plus 2, and plus 3. Plus 3 is the significant meconium. B is for the blood stain. Now what are the alerts? If it is 3 plus meconium and blood is there, that is the alert. So why it could be there? like uh, uh, like uh, for bleeding, there could be abruption previa, vasa previa, or a uterine rupture. So what if the alert is there? What to be done? Like if thick meconium and blood stained liquor, so it has to be informed to the senior health professional and follow the clinical guideline. And if it is not there, labor is progressing well, then every further examination is done after 4 hours. Okay, so this is the guidance for completing section 3 of LCG. Then another, fetal position. This part was asked by the role player in exam. Okay, so fetal position, yes, is it will be after PV, A, P, T, A for occipito anterior, P for posterior, and T for occipito transverse. Now what are the alerts? P and T are alert, occipito posterior is alert, transverse position is alert. If you find any alert is there, please circle it. And what you will do, what will be your plan? So if PT is there, senior healthcare professional to be informed. And if it is anterior, the next examination will be in 4 hours. So this the role player was asked in the exam. Next, move to caput. He asked a definition of caput in the exam. So what we will say, caput definition. Caput is a diffuse swelling of scalp, and that happens when the head lies uh, in same position for a long time. So this is a definition of caput. So caput, uh, again divided into three parts: plus 1, plus 2, plus 3. Plus 3 is like alert. So if you find a patient have plus 3 caput, do put red circle over it. And what will be the plan will be speak to the senior health professional, and if everything is fine, please do next PV after 4 hours. Okay, so this is the plan. Now coming to molding. Molding is overlapping of a fetal bone. So if it is 0, that means suture just opposed. 2 plus overlapped, but we can reduce it. 3 plus overlapped, not reducible. Alert is 3 plus. 3 plus is alert. Again, what will be the plan? Speak to the senior health professional, and he would review, and according to the local protocol, patient will be seen. And if it is normal, then next PV in the 4 hours. Okay, now this is the example for filled this section 3 of LCG. Now you can see fetal heart rate, they are measuring it. This was like 1 minute. Okay, this was like 1 minute. what we saw, and this is like 30 minutes. So now in single rate they put the fetal heart, and here it is they are putting the variation, a deceleration. So late deceleration they have to put circle, but they didn't find it, so it was fine. Meconium 3 plus, okay, meconium is 3 plus. Okay, these are the parameters for alert. These are the alert parameters. Okay, these are the alert parameter. They find it clear, fine, we are happy. Pos- Fetal position alerts are posterior and transverse. So in what they found is posterior, so it is a alert, so they put it red color circle. Caput 3 plus, ideally I don't know why they put 0. It should be, no, in this is the alerts. For example, in their finding, caput is, there is no problem with the, no caput is there in their patient, no caput is there. So these are the threshold, and this is the patient finding. Okay, this is the patient finding. So okay, this way they like find out the alerts and they will circle it. Now coming to the section 4 of LCG, this include all observations about mother. So pulse, systolic blood pressure, diastolic blood pressure, temperature, and urine. Now what will be the abbreviations for urine? uh, P, no protein. P, this is trace. P minus, no protein. P trace is trace of urine. Then +1, +2, and +3, that we already know. Urine. Acetone, no, A minus, no acetone. Then +1, +2, +3, 4. So these are the abbreviations for filling like a section 4 of LCG. Now what will be the guidance for filling section 4 of LCG? So pulse, first was the pulse. So pulse has to be like reported. They have to count the pulse 1 minute. Now what are the, then they will record it, then whether it is alert or not. So if it is less than 60 or more than 120, then it will be alert. So like then if it is if the patient is alert, then health they would inform senior, and if it is fine, then they will record pulse rate 4 hour, every 4 hour pulse rate. This is the plan. Every 4 hours pulse rate has to be recorded. Now coming to systolic blood pressure, they will measure it, they will record it. Alerts are less than 80, more than 140. So if it is alert signal, then they will speak to the senior healthcare professional. But if it is fine, then they will check blood pressure 4 hour. Diastolic pressure they will measure, they will record. More than 90 diastolic or equal to more than 90 diastolic will be alert. For alert, they'll speak to the senior health professional. For less than 90, so then it is normal. So they will measure it every 4 hours. Okay, so this way they assess the parameter, then they put in the labor care guide, they record it, then they check the threshold, and if the threshold alert is there, they will circle it around. After that, they will put a plan for that particular parameter. Okay, this is the basis or basic of filling labor care guide. Now another was temperature. They are measuring auxiliary temperature, and they are measuring it in a degree Celsius. So, if it is less than 35, more than 35.7, these are alert. If it is alert, speak to senior. If it is fine, see it 4 hourly. Protein, the urine strip is like proteins are checked in, or acetone is checked in the strips. So like if it is there, if it is trace or +1, +2, +3, and +4. So protein 2 plus, acetone 2 plus, these are the alerts. So if the alert is there, they will do full clinical examination, involve senior professional. But if it is fine, if protein is fine, negative trace or +1, then every 4 hours, or each time patient voids in the labor. I don't know why they are measuring so many times protein, but this is what the LCG says. If it is negative or trace or +1, then every 4 hours or each time patient voids, they want to see protein. appear to be a little different, but yes, it is the guidance of LCG, so you should know it. Okay. Now, this is the example for filled section 4. Now, these are the parameters, these are the threshold, and this is the patient value. Okay, this is the patient value. Pulse is this, systolic, diastolic, temperature, and urine, protein, and acetone. Now, all are normal. After now, 1, 2, 3, 4. After 4 hours, again measurement is done, and that is also fine. Okay, so I have explained the four sections how to fill LCG. Any one of you have got any question till now, or I should move ahead? Okay, so I should continue. No questions there. So this is the section 4. So section 5, and section 5 is about the labor progress. Very important part, labor progress. So they will look at what contractions in 10 minutes, duration of contractions, also cervical findings, and also descent of head. Okay, so these are the parameters they are looking in section number 5. So section number 5, like what they will. So first let's talk about contractions. So they will count contraction in 10 minute over 10-minute time. Then it has to come in absolute number, like 3 contraction, 4 contraction. What will be the alert? Less than 2 contraction in 10 minutes, or more than 5 contraction in 10 minutes is the alert. If the alert is there, then what they will do, they will repeat again. 10 minute after a 10 minute, they would repeat it again. And if it is still she's the contractions is alert, then senior professional they'll speak to the senior person. But if the contractions are fine, no problem, like they are within limit. So first stage of labor, they will look at contraction every 15 minutes. Second stage of labor, they will look contraction every 15 minutes. Sorry, so first labor every 30 minutes they will check contraction. Second stage of labor, they will check contraction every 15 minutes. Okay, so these are the plan. Now, duration of contraction. Okay, duration of contraction. So I if it is less than 20 second, or if it is more than 60 second, uh, then like in that situation both are the alert. If it is less than for 20 second, then inadequate uterine activity. And if it is more than 60, possibility of hyperstimulation or obstructed labor. There, in this part, there is a change from the previous partogram. In partogram, they used to check the strength of contractions also, but in LCG, strength of contraction they have removed. They are speaking about number and duration of contractions only. And so these are the alert. If the alert is there, then they will verify it one more time after another 10 minutes. If it is still alert, then a senior professional would be informed. But if it is within normal range, then they will look contractions, uh, duration also, number of contraction and duration would be checked every 30-minute interval in first stage of labor, and every 15-minute interval in second stage of labor. So this is the guidance for filling section 5 of LCG. Then another guidance. So this is also like too much clumsy, but it is important for the cervix. So what they are doing, so with the vaginal examination has to be done with the consent, is maintaining privacy, aseptic technique, and it should not be done during the start of contraction. Okay, should do not start examination during uterine contractions. So an all assessment for all parameters has to be done when they are doing pervaginal examination. So in in first stage of labor, cervical descent is denoted by a cross. Okay, that we know it from the partogram also. But in second stage of labor, uh, the word mnemonic, sorry, the pushing when begins, they will use the alphabet P to indicate. This second stage observations again has been added newly in the labor care guide. In previous partogram, WHO partogram, this was not there. So this is again a new thing, that P pushing will be added when the patient start pushing in second stage. Okay, so this is the record. Now check, these are the checking for threshold. This is like this is alert values for alert value for first stage. These are alert value for second stage. So alert value for first stage. So if the all of you mute yourself, there is a request, please mute yourself. So if first stage of labor, these are the alerts for first stage of labor. If the patient is in first centimeter 5 centimeter, and more duration more than 6 hours, then it is alert. You will put red line, red mark there. If the patient 6 centimeter is more than 5 hours, then also it is alert. If the patient has 7 centimeter and more than, there had been 3 hours passed and no progress, then it is alert. For 8 centimeter dilatation, if it is more than 2.5 centimeters, she remains in 8 centimeter, that means it is alert. If 9 centimeter and she remains more than 2 hours, then it will be alert. So you have to know the alert values, but need not to remember, because when the labor care guide is given, these alerts are already written uh, in the column, so you will be able to review that. Apart, so these are the alerts for first stage of labor. These are the alerts for second stage of labor. So for nullipara, if the active stage more than 3 hours, and if multipara it is more than 2 hours, so these are the alerts. Now if it the parameter comes in alert, then they will speak to the healthcare professional, and if everything is fine, then they will do assessment of the labor every 4 hours. They will do assessment of the labor every 4 hours. But sometime it is possible that PV has to be done less than 4 hours, but reason has to be specified, and the PV less than 4 centimeter to be done if the like it is sure that examination will add any important information in decision making. So this is also important to know. So these are the threshold for cervical dilatation for first stage of labor and for second stage of labor. Now coming to the descent we know had it is by abdominal palpation. It usually had it is divided into five part. We already know from our previous knowledge, 5 by 5 head is totally in the abdomen only. 0 by 5 head is in the pelvis. Usually reference threshold is not given for head descent, and head we know it is circle, it is a round shape, we already know. So the head they put alphabet uh, O or 0 for it. Okay, it is O or 0 for it. Apart from this, examine first stage every 4 hours. The examination has to be done and the descent has to be reviewed. And second stage of labor, it will depend how the patient is pushing, how the position is there. So, and the PV is done when any decision has to be taken. Okay, so this is about the descent. Now what is the example? Now you can see, so this is the, these are the contractions, these are the threshold. So contraction is fine every time it is within 2 to 5. This is first stage of labor, this is second stage of labor, nothing alert. Contractions in first stage of labor, this is the duration, so we are also happy, no alert sign. And this is second stage of labor, we are happy. Coming to cervix, so at, at the 5 centimeter they started. Okay, 5 centimeter we start LCG, then after 4 hour they will do and it was no alert there, so they will do PV after 4 hour. 1 2 3 4, after 4 hour they do PV, and they find it is 8 centimeter. Okay, so it is good progress. Then after 1 2 3, now they have done PV 3 hours. maybe patient is fully dilated or whatever, so it is 10 centimeter. So this is cervical dilatation. Okay, this is cervical dilatation. And here the patient start, now patient is fully dilated here, 10 centimeter. Patient in the second stage of labor. So patient is started pushing. Okay, so they wrote P. So this part was not there in partogram, that you already know. Now this is descent. So when at the five, so the, so this is this way the head is descending. So when the PV is done at here they did PV, so head was at like at 4, uh, and when they did PV here after 4 hours, so this is the PV they are doing. So head is descending, so 3 it is 3 by 5, and here it is coming to 2 by 5. So head is descending well. Okay, apart from this, then after that they have done PV here. So but obvious, in the second stage of labor, head has fully descended, so it will be same only, how no much already descended, so it is same. Okay, so this is descent of the head. So this is example for field section 5 of LCG. Now this is section 6. Section 6 is medication, oxytocin, medicine, and IV fluids. So these are the abbreviations for section 6 of LCG. Oxytocin N, then it is if it is not there N, if it is there, then you either unit per liter or drop per minute. Medication, if it is not, and if it is there, then name, dose, route of medication. IV fluid, yes or no, that is Y and N. That depends when the patient is on fluid or not. So about the oxytocin. Now, if the oxytocin is being administered, need to write unit per liter or drop per minute. If it is, and if the oxytocin is used, then record the amount every 60 minutes. They have to check for oxytocin. Now any medication, no, if it is not there, then no. If it is there, then they have to put the route and dose. For example, 50 milligram pethidine intramuscularly. So dose, name, and route. Now second, IV fluid, if it is there, yes. Not there, no. So routine administration of IV fluid is not recommended, as it reduces patients mobility and unnecessary cost. Low risk women should be encouraged to take oral fluid. They should receive oral fluid when it is indicated. Okay, so all women will not get IV fluids. Now this is the example. So patient is not, now looking at it, you can do interpretation. Patient is not on any oxytocin first stage of labor, second stage of labor. Patient was not in any medication in first stage of labor, second stage of labor. Patient was not receiving any fluid in first stage of labor and second stage of labor. So therefore interpretation is must. By looking at the labor care guide, you'll be able to see what is happening. This is the last section, that is a shared care. Again, this has been newly added in the labor care guide. So this is the assessment of the patient and this is the plan of the patient. So what will be the guidance for it? So record all assessment and additional finding that has not previously documented. Like then plan has to be done. Plan will be continue routine monitoring, any test is required, any augmentation is required, any ARM is required, any intervention like forceps or vacuum is required, cesarean section is required. And these are the whenever this plan is made for test, oxytocin, ARM, vacuum or forceps or cesarean section, whenever this decision is taken, everything will be explained to the woman, and woman should be involved in discussion, and she will make informed choice. Because of that, after assessment, when the plan is done, it is woman is in woman involved in all discussion. Because of that, it is shared, it is a shared care or shared plan. So each time a mother and baby well-being completed, record the plan and make shared decision. So patient to be informed, and the shared decision has to be made. This column has added new in the labor care ward, labor care guide. Now this is the field, this is the now filled example. So like here assessment they have done assessment, and they find that patient requires pain relief. So what are the plan they have made? Offer companionship, uh, relaxation technique, continue routine monitoring. Okay, then here normal progress was there, so continue routine monitoring. Here is the health care professional signature. Okay, initials of the healthcare professional. Here pain relief required. So again companionship, pain relief, encourage for mobilization, continue monitoring. Here is the normal progress, so continue monitoring. Second stage of labor, normal progress, continue routine monitoring. So this way shared care, shared decision making is done. So this part is different in the labor care guide. So that's all I have to I have to say about labor care guide. What was the importance, and what are the section, and how to fill it. Any one of you have got any question can ask me.
Yes,
Any
doctor. In
question?
the when in theory the feel the blood pressure. When the blood pressure is normal, you are said to check every 4 hours.
Yes.
Yes,
What is hmm
but
yes,
in the
yes.
field spaces like that every 1 hour, 1 hour, 1 hour, or just can write it in 4 hours if normal.
No, so whenever you are checking, that time you will fill it.
Okay, okay, thank you.
Okay. Okay, so one of the student has already asked to do station. Who has asked me? One person has asked, can you do station?
Yes, ma'am.
Hello? Yes, okay.
Hello.
Yeah, yeah. So now this is the station. So read the station.
Okay, ma'am.
I have got one more paper.
Okay, ma'am. Okay, ma'am. Next.
So whenever you wish to start, you can tell me, so I'll put timer on. Should I start the timer?
Yes, ma'am.
Okay. Start.
Hello. Yeah.
Hello.
Hello. I'm one of the SD5, and you are.
Yeah, I'm Alice.
Hi, Alice. I understand that you are new here. How's everything in the department?
Yeah, yeah, all well. I'm enjoying working here.
Okay. So, um, I understand that you want to know about WHO Labor Care Guide. Is that right?
Yeah, yeah, yeah. Because there have been, WHO Care Guide has been updated in 2021. So I just want to know, what are the updates and how we will use it, and what is importance of it.
Okay. I really appreciate your interest. So, can you tell me what you already know about it?
Yeah, I know that we use it to care, monitor the labor and maternal findings in the labor, but I'm not aware about the updates.
Yeah. Okay, that's right. So we use this labor care guide to we find assess the mother and will document the findings to assess mothers and babies well-being. Okay, this is why it's important. Okay,
Okay. Mm-hmm.
and what we need to do with it, we want to find out any complication at the earliest so we can take proper steps. At the same time, we want to avoid unnecessary interventions. All right.
Yes. So at
Okay.
what
So can you?
centimeter it is started?
Okay. So before we were using starting it at 5 centimeter, as you already know, right? 4 centimeter. Now we start it at 5 centimeter. Okay.
Okay. Why this change has been made?
Okay. So what we want to do is we want to avoid, premature diagnosis of active first stage of labor. Okay, because everyone's assessment is different and every woman has a different progress in labor. So you want to
Mm.
avoid a premature diagnosis of the first stage of labor. Okay, that's why we
Okay.
are starting it at 5 centimeter.
Okay.
Okay,
Mm-hmm.
so
Mm-hmm.
can here we have a paper in front of us, the labor care guide. Okay,
Mm-hmm.
so
Mm-hmm.
let's see. It has few components. Initially, it has patient's information. Okay, then
Mm-hmm.
if there is supportive care available or not, how's the baby doing, how's the mother doing, okay, and how's the labor progressing, and if the mother received any medication, and at the end we'll make a shared care for the shared plan for this woman. All right.
Okay.
So can you just tell me one of the components?
Yeah, yeah. Like supportive care is there, and the shared care decision making is there. I'm unaware of these two components.
Yeah, these two are newer than partograph. Okay. Okay,
Okay.
so let's see. In the beginning, there is a place for name. So we'll put the woman's name here. Then the parity, and there is a labor onset. So we'll put here if the labor was spontaneous or any induction was there. Okay,
Mm-hmm.
and there is active labor diagnosis, the date and time. If it's a uh, if it's known, then we will put the date and time. And if the membrane is ruptured, and then
Mm-hmm.
we'll put if the membrane is ruptured, if the woman knows at what time and what date it was ruptured, we'll put it there. Okay, and if it's unknown, then we
Okay.
will put you there. And if there is any
Okay.
risk factor for this woman, like any preeclampsia or any diabetes, we'll put it in the risk factor column. All right.
Mm-hmm.
Okay, now the first part of the page, as you can see, there is a column for time, and every column is indicating 1 hour. Okay, and this chart is divided into two parts. One is active first stage, and another plotting is for the second stage of labor. Okay,
Mm-hmm.
as we already know, in primary patient active first stage, we will wait for 12 hours. So as you can see, there are 12 columns here, and in the
Mm-hmm.
second stage we can wait for up to 3 hours. So there are 3 columns here. All right.
Mm-hmm. Yeah, yeah, yeah.
Okay.
Mm-hmm.
Okay. So the next we can see the supportive care column. There is 4 parts of it. There is if the companion is present, absent, or the woman declines it. Okay, and if the pain relief option, oral fluid option, F, and the posture. As you can see, there is in the next column it's written alert. Okay, so when we
Mm-hmm.
have to be alert about the situation, when the woman says no for a companion, so we have to find out why, and we have to offer her whatever is suitable for her. Okay, for
Mm-hmm.
pain relief also, if the woman says no, we have to be alert about it. If the oral fluid also, if she's not taking adequately, then we have to be alert about it. And about the posture, if she is in supine position, like she is not mobilizing well, then we have to be alert about it. Okay,
Mm.
and if we find any alert findings, then we'll circle it. Okay, so
Okay.
we can see it clearly. Okay, next is baby's finding. Okay, so we'll see the baby's baseline heart rate. It's normally we'll see it for 1 minute. Okay, and
Mm-hmm.
we'll try to see it after contraction. And if it's less than 110 and more than 160, as we already know, it's a alert and we have to circle it. Okay, and then
Okay.
if there is any deceleration, okay, so we already know there is type of deceleration like early, late, and a variable deceleration. So if it's a late deceleration, we have to be alert about it. Okay, and we have to circle it. Then about the
Okay.
amniotic fluid, if the membrane is intact, we can put it by I. If it's ruptured, then R. And if it's meconium stained or blood stained, okay, here alert is meconium stained grade 3. And if it's blood stained, then we have to be alert about it, okay.
Mm-hmm.
Fetal position, we have to see if it's occipito anterior, occipito posterior, or transverse. If it's posterior or transverse, we have to be alert about it. Okay. As you know, caput is the swelling in the fetal head as it stays in the same position for longer time. If it's 3 plus, then we have to be alert about it. Okay.
Mm-hmm.
And
Okay.
molding is overriding of fetal bones, and if it's 3 plus, then we have to be alert about it, and then we need to plan a further care for her. So what we are doing is we are assessing the woman, putting her records on this care guide, and then we are seeing if it's crossed the threshold of alert or not, and then we are making a further plan that what we will do with the further plan of this woman. Regarding the woman, same way we'll observe her pulse, BP, temperature, and urine for protein. And if any of the values comes in the alert line, we'll mark it. All right.
Yeah, yeah.
Okay. And the most important part is labor progress. Okay. Here, the upper part, you can see the contraction per 10 minutes. Okay. So we will observe the contraction per abdominally for 10 minutes. And if it's less than 2 or more than 5, then we have to be alert about it. And duration of contraction. If it's less than 20 seconds or more than 20 seconds, then you have to circle it and be alert about it and make a plan. All right. And then there is labor.
Yeah. So what about, yeah, what
Yes.
about the shared decision making? What is shared decision making?
Shared decision making is any alert observation will put in the upper part, in the assessment part, and the plan will discuss with the woman, inform her, and together we'll take a plan for her. Like we'll carry on with the regular observation every 4 hourly, okay? Or we'll
Mm-hmm.
do a artificial rupture of membrane, or we need to do a instrumental delivery. So we will
Mm-hmm.
discuss our care plan with the woman, and together we'll come to a shared plan for her, and we'll write it, and in the last part we'll write our designations initial. Okay.
Okay, so like what are the differences between WHO partogram and WHO labor care guide?
Okay, so here we have this supportive care which we didn't have it here, and as we discussed that here we are starting with the active stage at 5 cm, there we were starting with 4 cm, and this shared care is also added. All right, and in the dilatation of cervix here, okay, there is no lines, and there is another column for the second stage also, which was not there. Okay, thank you for your time.
Okay, okay, well done. Okay, very nicely, nice. But again, the time is a problem. So, like, in my opinion, you have to a little fast. Every part you can't explain. Every part,
Okay,
detailed explanation cannot be done because role player will also ask question. Okay, like in
okay,
between I interrupted and start asking question, so a little fast you have to do it so that you'll be able to give feedback also. Take
okay,
feedback, give feedback. That part was left, but yeah, your
okay,
exam will be online and you will have a timer on the screen. You were not able to see timer. Rest you did well.
okay. Thank you, ma'am.
Okay, now coming to the answer, the questions asked by the junior colleague, what I got to know, he asked about why it is at 5 centimeter. Then, like, what is the mean by shared care? What is the position caput molding? He wanted to know the difference between partogram and labor care guide. So like you have to keep on explaining uh, all 7 sections of it, but in the meantime you have to be a little faster because everything cannot be done in 10 minutes, and he has got all these questions also. So how to do this station? Hello, I'm Priyata, part 3 candidate. Can I check your name? Nice to see you. Okay, Alice, how are you doing? How long are you with us? How is your training going on? Do you feel supported? Bully check done. So, check the background knowledge. Have you got any idea? Like, have you read something about labor care guide? Okay, so have you had idea about the WHO partogram? Yeah, wonderful, fine. So, can you tell me the reason why you want to learn about it? Like, um, uh, what is running in your thoughts and why you want to learn? So she'll say something about it. So do all make repo making. After introduction to repo making, bully check, background knowledge check, and the check for the reason. Then just set some agenda. So in today's session, I'll be speaking about labor care guide, its importance. I'll explain whole sections of it and what is the difference between partogram and labor care guide. How that sounds to you? And if I'm not clear at any moment of time, you can stop me, isn't it? Now let me start with the importance. So this importance of the labor care guide, so at least say two. So first of all, it helps us guiding monitoring and documentation of well-being of mother and baby and also assess labor. Second, it helps to identify any identifying and addressing any emerging labor complications so that it can trigger action against it. Apart from this, it prevents unnecessary intervention in labor and to support audit and the quality care improvement of the labor ward management. So these are the importance. Then just ask her, can you tell me what is the importance? So he will repeat after back you at least one importance. Then you have to say, okay, come to labor ward guide. Let me tell you that labor LCG has been divided into the 7 section. So first, let me tell you, this is section number 1. This is the demographic detail of this patient, and we do have a guidance so that we can, how to fill it. Then this is the time, and this is the time when he has to come to labor ward. Okay, this is 1 hour. So this is first stage of labor, and this is second stage of labor. So this is section 1. Okay. Now coming to section 2, you have to give brief. Section 2 is a supportive care, and there are 4 components here. Then explain at least 4 component and ask her, okay, tell me about the one component. Then explain. Then just say that it was not there previously. It is just I have started. It is this column. Section 2 is a new update. Okay. Then come to section 3. Section 3 is baby. Then speak about the all these findings and just ask whether he wants to know more. But in the exam, he asked caput and molding. So you can say caput is swelling and the baby's head. That happens when the baby is present in a same position for a long time, and we just grade it +1 +2 +3. Again, he asked the question in the exam molding. So just say this is an overlapping of feet like a feet baby bone. +1 +2 +3 +1, they are just touching. Second, they are coming together but we can separate it. Third, they are they are overlapping, so we can't separate them. So this is molding. Section 4 would be women care. These are the these are the parameters we are looking, and these are the safety alerts. If any parameter um, is not in the safety zone alert, so all alerts we put a red circle. So this is for first stage, this is for the second stage. Move to section 5. So section, then explain the section 5 to her. Another difference here, previously in the partogram, strength of contractions were measured, but here duration, and when she started is a new change. Okay, then keep on asking question to him, then explaining him. Then this is the sections 6 for the medication. And this is the like the section 7, and this is a shared care, the shared decision making. So just explain in a brief, then explain importance we have explained. Then he asked in the exam, why we start at 5 centimeter. Answer, we started at 5 centimeter, that would reduce premature designation for active stage phase of labor, and also this will avoid any poor designation of labor progress, early designation of labor progress, and unnecessary interventions. Because of that, this is a change. LCG starting at 5 centimeter. Another question he asked about the position, caput, and molding. So this part I have already explained you. Same explanation you have to do. Again, he asked in the exam, what is the shared decision making. So shared decision making is the is the continuous communication with the woman and the companion whenever we are recording all assessments, and whatever the plan is made, it is always shared with the woman. So clear explanation of the plan and their purpose for every procedure, whether it is like oxytocin, whether for progress, whether it is cesarean, whether it is an instrumental birth. So clear explanation of procedure and their purpose is given to the provided to the woman. So all form of physical examination, and after that, what are the interventions of that examination, explained to women and the birthing partner very clearly, so that they can make informed choice. So the this enables us doing shared decision making. So it is like it is not only health professional that who is looking at the alert and making decision. Every after every checking and recording, explanation to the woman and birthing partner, and further plan explained to them. So that would be, this is the shared decision making. So then he asked, okay, so then he asked, what is the difference from the partogram. So this is the partogram, okay, this is the WHO partogram. So in the WHO partogram, fetal well-being, labor progress, maternal well-being, medications, so these parts were there. But what is the difference? So this is the difference between WHO partogram and WHO labor care guide. So I have just summarized it here in the table. So what are the new changes, additions? Now it starts at 5 centimeter. Reason I have explained. Section 2 of supportive care and section 7 of shared care had been newly added. Okay. Another second stage of labor is added, and there is an intensive monitoring in the second stage. Alerts circle. Apart from this, so these are the changes, the additions in the new from the WHO partogram has been done in labor care guide. And what the deletions? Fixed 1 centimeter action and alert line has been removed, and strength of contraction also has been removed. So these are the changes that these are the deletions has been made from previous from the previous WHO care guide. So that's all he asked in the exam. So this is the same template. Now I have did introduction, did my repo, put agenda, I explained the importance of LCG, explained all sections, and explained whatever he asked in the exam. Then at the end I have to give feedback. So you are a very enthusiastic learner, and take feedback. Can you give me feedback for my method of teaching? I'll give you certain handouts so that you can learn more. Whenever you are have any concern, you can come back. I'll be helping you out. Thank you for your time. Enjoy. Have a lovely day. So this is the complete answer key to the patient to the labor care guide station that came in the exam. With that, thanks for joining. Any question anyone can ask me. Anyone, any question? Anyone, any
Yes,
question?
yes, yes, Miss. Also ask about the latent phase. How
What
definition of
latent phase has been removed from this.
okay.
Latent phase is not there. Latent phase was not there even the WHO partogram also. There they were starting for 4 centimeter, and now here starting from 5 centimeter. Latent phase has completely been removed because there is no fixed definition. Okay.
Okay.
Any other question?
Question, ma'am. Am I audible, ma'am? Hello, ma'am. Am I audible? Hello.
Hello, no voice and no screen. Hello. No voice till now.